Good afternoon and welcome to Preventing Youth Drug Overdose Strategies to Keep Students Alive and Healthy, hosted by the White House Office of National Drug Control Policy and the U.S. Department of Education. I'm Beth Conley, the Assistant Director for the Office of Public Health at the White House Office of National Drug Control Policy. We have a timely and informative town hall for you today, which will be kicked off by Dr. Rahul Gupta, Director of the White House Office of National Drug Control Policy, and Dr. Miguel Cardona, Secretary of the U.S. Department of Education. You will hear about the innovative work being done at the local level where schools, health departments, and administrators are working together to prevent student drug use and coordinate efforts to prevent and respond to student overdose. I have the honor of introducing our first two speakers today. Dr. Rahul Gupta is the first medical doctor to serve as the Director of the Office of National Drug Control Policy, or ONDCP, a component of the Executive Office of the President. ONDCP coordinates the nation's $43 billion drug budget and federal policies, including prevention, harm reduction, treatment, recovery support, and supply reduction. Through his work as a physician, a state and local leader, an educator, and senior leader of a national nonprofit organization, Dr. Gupta has dedicated his career to improving public health and public safety. A board-certified internist, Dr. Gupta has been practicing primary care for more than 25 years and has served in private practice and public health in towns as small as 1,900 residents and cities as large as 25 million. He has served as a local public health official and as the West Virginia Health Commissioner under two governors, where he brought together public health, law enforcement, healthcare, faith-based business, and other community partners to solve local problems in novel and innovative ways. As the state's chief health officer, he led the opioid crisis response and launched a number of pioneering public health initiatives to expand access to Naloxone, as well as treatment services, including those for incarcerated individuals, in order to save lives and help people transition back into society. He supported the expansion of harm reduction programs to more than a dozen sites across the state. He was also instrumental in expanding the state-of-the-art, comprehensive, and integrative medical and behavioral health programs for pregnant and postpartum women. His lifelong commitment to educating the next generation of physicians and policymakers has led him to hold academic appointments at a number of universities. He has been recognized for his career of public service by the American Medical Association, the American Public Health Association, Governing Magazine, and the Pulitzer Prize-winning Charleston Gazette Mail. Dr. Gupta. And we also have with us Dr. Michael Cardona, who was sworn in as the 12th U.S. Secretary of Education on March 2nd, 2021. Secretary Cardona's experience and his bicultural upbringing have helped shape his passion to serve all students and improve their opportunities for success. Secretary Cardona's focus throughout his career on raising the bar for equity and excellence in education for all learners guides his leadership at the U.S. Department of Education, which serves the nation's 65 million students, ranging from pre-kindergarten to adult learners and their families. Over the last 2 years, Secretary Cardona has led the nation's efforts to safely and successfully reopen schools for in-person learning, distributing historic education funding for P through 12 schools and colleges, working to increase higher education access, affordability, and student success, and leading unprecedented federal efforts to transform the country's student loan system. Across all these areas, Secretary Cardona has highlighted the urgency of seizing the moment through intentional collaboration, particularly working in partnership with parents, families, students, and educators, and the opportunity we have as a nation, not only to recover from the pandemic, but to reimagine a higher performing, more equitable education system that works for all. In the year ahead, the department will be focused on achieving academic excellence and accelerating learning for all students, delivering a comprehensive and rigorous education for every student, eliminating the educator shortage for every school, investing in every student's mental health and well-being, and providing every student a pathway to multilingualism and ensuring every student has a pathway to college and a career. I'd like to ask each of our featured speakers for some opening remarks. Director Gupta, a few words.
Thank you, Beth, and hello to everyone joining today. We're thrilled to have my friend, Secretary of Education, Miguel Cardona with us, as he's a champion for health and academic success of America's students. We invited you to join this conversation because our youth are facing more drug-related threats than ever before. And it's up to us to help ensure their health and safety, both in and out of the classroom. You know, my father was an Indian diplomat, and I spent my academic years in K through 12 schools in Montgomery County, Maryland, in public school system. In fact, my high school, John F. Kennedy in Silver Spring, was in the news recently for the very reason that we're gathered here today. A 15-year-old overdosed during the middle of the school day. Now, we're lucky that first responders got there in time to provide life-saving first aid, and that's not always the case. You know, you have to ask yourself, why is this happening? It's because our kids are today facing challenges like never before. And because the drug supply is deadlier than it's been ever before. Our kids were already facing mental health challenges and the stress from being teens in the time of social media, and COVID compounded these and added loneliness to the boot. Now, this has all been driving up substance use. And by late 2021, the number of adolescents dying from drug poisoning each month more than doubled, with 84% of these deaths involving illicit fentanyl, including fake prescription pills. Now, what's worse is that two-thirds of adolescents' drug poisoning deaths occurred with others nearby, by bystanders nearby. But Naloxone, the antidote, was not available to be administered. Now, to me, that means that these lives could have been potentially saved. So our youth need to know the risks they face. Today, too many are buying pills on social media platforms that seem legitimate. But if you look at the DEA data, it shows that 6 out of 10 actually contain a potentially lethal dose of fentanyl. You know, that's more dangerous than playing Russian roulette with your life. It's absolutely critical right now that parents and students know the risks and what they can do to stay safe. And therefore, the Biden-Harris administration is committed to preventing youth substance use and overdose, including funding our drug-free communities coalitions in communities in all 50 states, and spreading awareness about our new social media campaign, warning youth about the dangers of illicit fentanyl and how they can save a life with naloxone, and so much more. So today we're sharing resources with school leaders, educators, and healthcare professionals, and this is why it's so important for schools to be leading this fight. So thank you all for being here. And now I'd like to welcome Secretary Cardona, who is leading these efforts to help keep our kids safe from substance use in school settings.
Thank you very much, Dr. Gupta, and I appreciate the opportunity to join forces with you on something that we know affects so many families across our country. You know, I come as an educator. I was a fourth grade teacher. I worked in a school system for many years, and as a father, I come as a father, and I've spoken to educators and parents across the country who have shared how much of a concern this is, and the sense of urgency of now, we have to do something differently. So I'm really happy to be here. I want to thank not only you, Dr. Gupta, but Elizabeth. I want to thank Mark, Kate, and Gustavo. Look forward to hearing from you. You know, today's focus is to hear from you what's happening in the field, so that we could take what you say and really make sure that we're being influenced by your perspective of what's happening in our schools, in our communities. So when we make decisions and we're thinking about what we could do in DC, it's influenced by your perspective. We know our schools right now are on the front lines of fighting the fentanyl pandemic and epidemic, and we have to join forces. It's time now that we recognize that if we do what we've done in the past, we're going to get the same results or worse. It's only going to get worse. So, you know, what I like to think of is this is an opportunity, like it was 3 years ago, for us to join forces through intentional collaboration. 3 years ago, I had epidemiologists on speed dial because we needed to do that to safely reopen our schools. Well, today, the epidemic is a little bit different, but it's changing lives, it's taking lives, it's impacting families, it's influencing our students' ability to be their best selves. So we need to come together with that same urgency, that same passion that we did 3 years ago when we were trying to reopen our schools. I look to hear from our guests here, our colleagues, what we could be thinking about, how we engage community partnerships, how we link the mental health support, trauma support, professional development support to make sure that we have the capacity in our schools, in our districts, in our states to address some of the underlying issues, how we can promote information to make sure parents and students and educators have up-to-date information and know how to stay away from that. There are people who are working full-time to try to trick our students. How do we stay ahead of the curve to make sure that we're protecting our students? We've lost too many children. We've lost too many youngsters to this. We know it's just going to get worse unless we get on offense and we come together, again, through intentional collaboration, listening to what's happening and make sure that we're equipping ourselves with information, but with clear strategy on how to improve this. We've lost too many beautiful lives. For the brave students who overcome substance misuse, we stand with you. We want to support you. To the families that are struggling with this at home, we see you, we hear you, we want to support you, and we want to be there for you. We're in this together. That's the message that I want to say. We may not have all the best answers right now, but this is why we're coming together. I want to again acknowledge Dr. Gupta for the level of urgency and for reaching out and saying, look, we're going to get farther if we work on this together. So the U.S. Department of Education, the Biden-Harris team, we're committed to making sure we support, but that takes listening. So today, our job is to be listening to what the experiences are out in the field and what we can do to continue to support our students, our families, our educators, and our school communities. So we're going to continue to work together to protect our nation's students, and I look forward to the conversation and to learning from the folks who are on the call today. Thank you.
Thank you both. Let me introduce our panelists to our audience today, and then I'll turn it over to Secretary Cardona to kick us off. So first we have with us Dr. Gustavo Balderas, who joined the Beaverton School District as superintendent in July 2022. Dr. Balderas is a nationally recognized educator known for his equity-driven leadership, who has a proven track record of ensuring that all students achieve academic success, as well as social emotional growth. His numerous awards include the 2021 Champion for Equity Award from the Association of Latino Administrators and Superintendents, the 2020 Oregon Superintendent of the Year Award, and from the Coalition of Oregon School Administrators, and the 2020 National Superintendent of the Year Award from the American School Superintendents Association. Welcome, Dr. Balderas. Dr. Kate King serves as the president-elect of the National Association of School Nurses and is a school nurse at World Language Middle School for Columbus City Schools, the largest school district in the state of Ohio. She also serves as the president of the Ohio School Health Services Association. Her background includes specialty areas of community health and adolescent psychiatric nursing and school health legislation. She has been active in her regional and state school nurses association. Dr. King is passionate about providing equitable healthcare for children in schools through collaboration, evidence-based practice, and providing school nurses with the support and tools to serve the healthcare experts. Welcome, Dr. King. And finally, Mr. Mark Hodge is a senior administrator for school health services at the Department of Health and Human Services in Montgomery County, Maryland. He has served Montgomery County in many school-based roles, including nurse administrator and nurse manager, responsible for immunization programs, childhood and adult health clinics, and food and nutrition programs across the county. Welcome, Mr. Hodge. So Secretary Cardona, I'll kick it back to you.
Thank you very much. And, I just want to reiterate how pleased I am to hear from Mark, Kate, and Gustavo. Just the experiences that you've had is going to be really good for us to hear about. And I want to start with you, Dr. Balderas. Congratulations on your recent success, your ALAS award, and your passion for meeting the students where they are and supporting them. And, that's kind of what we're here for, right? there are students right now that are in need, and we need to help them. I'd love to hear a little bit more about your personal experiences with the rise in overdose in schools, and I'd love to hear from Kate and Mark after. But Gustavo, I understand you've lost some young people in your community to overdose, and that was the impetus for some changes to be made. Could you tell us a little bit about what happened and what the immediate response was in your community?
Yes, thank you, Secretary Cardona, for having me on. During the 2021 school year, we lost several current and former kids to fake pills made from fentanyl, including 2 students in a matter of weeks. It was clear that we needed to do something urgently. So we embarked on a fentanyl awareness campaign in April 2021, just as the fentanyl crisis was starting to get some pretty prominent national attention. This campaign, which we call Fake and Fatal, One Pill Can Kill, included a strong social media push and a live panel discussion event, followed by the inclusion of fentanyl-specific lessons for all secondary kids. We also partnered with law enforcement to do staff training, and our school board approved the use of Narcan in all secondary schools. This work was made possible due to the involvement of one of our families who lost a kid in our schools, John and Jennifer Epstein. They have since become national fentanyl awareness advocates. They trusted us to tell their story, which really made a difference and a strong impression in our community.
Well, thank you for sharing that. It's too often, we see cases where parents take a tragedy like this and then turn it into an opportunity for advocacy. So I want to thank them and the entire community for turning something so negative into an awareness, a campaign, and action. Thank you for that. Kate and then Mark, could you share a little bit any of your experiences?
Well, nurses are the most trusted profession of any of the professions. And in a school, the school nurse is the trusted first responder and medical provider. And so when we look at school nurses providing emergency care for students who have ingested an opioid or fentanyl accidentally, most often, we look to how school nurses can be that first responder. And I think everyone is clear that they would much rather have a school nurse be that first responder than a lay person who has some training. Time is of the essence. And so when school nurses have the tools that we need to save children's lives, it is essential. We have already often epinephrine pens. We have albuterol inhalers. We have other AEDs. We teach people CPR. And to have that tool of naloxone to be able to save a life is so important. Time is of the essence. So I know as a school nurse at my middle school, emergency response comes in general 5 to 7 minutes. Now I'm in an urban setting. If you're in a rural setting, if you're in a suburban setting, you really need to be able to respond very quickly and know how long it's going to take for an emergency medical response to come. Part of the school nurse's role is developing that plan with the knowledge that they have of the school, how the school works, how their community agency works, how EMS works, is pulling together that plan and supporting all school staff as a team, as a healthcare team in providing that care for students.
Thank you. You're right. Everyone trusts the school nurse. And when anyone in the building is not feeling well, they go to the school nurse. When I was a school principal, I would go to the school nurse. Thank you. And I like your idea of the plan. It can't be just random efforts. It has to be part of an orchestrated plan. And Mark, I know you'll get some deeper questions later, but your personal experience in this space.
Sure. So when I was a school nurse 21 years ago, when I started as a school nurse, we didn't have anything like this. We weren't seeing the amount of drug use that we're seeing now in schools. It may have happened outside of school, but certainly in school, the availability that there is now, it certainly has increased. The ability to get it, as Dr. Gupta suggested, through social media is something that we're seeing a lot more of. I have a 16-year-old son who talks to me about what those emojis mean, and so that's just something that's part of our part of the things that we need to work on now. We've given Narcan 15 times in schools this year throughout Montgomery County, Maryland. Each time it has saved a life. We happened, sadly, to lose 5 youth to drug overdose this school year outside of the school. So they were at home and unable to access a life-saving drug like naloxone. So our school nurses in each of those 15 cases in schools were the ones who administered that. It's really important that that healthcare is available for those students. It's not just about giving the Narcan and they wake up and all is good. It's the rescue breathing may need to occur. 911 is called. The EMS personnel arrive and transport them to the hospital. There's follow-up for accessing resources, referrals to treatment, other things that the nurse helps with following the administration of the naloxone. So it's really important that that school nurses and other school administrators and others are able to follow this student after that happens. It's not just about saving their life and moving on. It's making sure that they have access to resources after that.
It's an important point. Have a plan, but also have a follow-up if unfortunately you have to use it. Thank you.
And with that, I'll just also just want to, I mean, this is a really fascinating conversation because I think we're talking about plan, we're talking about follow, we're talking about literally saving lives. So I want to come back to you, Dr. Valderas. I'd like to hear we have so many folks online here. I'm sure we want to know what does it look like on the ground in the face of a changing environment. We know that drug education in schools isn't a new concept, but today's drug crisis is so different from what we've ever seen before. As Mark was mentioning, how has your district implemented this new curriculum that you mentioned, addressing the unique dangers of drug use for young people today?
Thank you. Our teaching and learning division developed specific fentanyl and opioid lessons for all 6th through 12th graders that they receive every year, whether in health classes or advisory. We've been very, very intentional about updating these lessons to reflect the current drug landscape. As you've stated, it's been changing, it continues to change, and will continue to only change. And I want to let my fellow superintendents know that are on the call that we've made all the lessons and teacher notes, in addition to our entire Fake and Fatal campaign, available to any district that wants to use them. You don't have to reinvent the wheel. The wheel's out there, but we can find everything on our website. We believe strongly that we equip young people with knowledge. They will make better choices. And hopefully you'll never find yourself needing to use Narcan. I should also mention that the Oregon State Legislature has followed our lead and just approved legislation requiring fentanyl education for all Oregon schools that our governor just signed yesterday.
And Dr. King, how have the school nurses, as you've mentioned, the plan development, had to change and adapt this prevention messaging and education to reach today's students, which often can be online or in so many different ways?
Well, fentanyl is the game changer because it is so fatal and it's so quick acting. We know as school nurses that there are many ways to educate students and prevent. So often we need to use this multi-pronged approach. We need to make sure that it's in the curriculum, as Dr. Valderas said. So that is something, and I'm going to say 6 through 12 is great, but I think we need to start earlier than that. And I'm sure you have a plan for that, Dr. Valderas. But we really need to let children know earlier because they see things in their homes, they see older siblings doing things, and we need to do that approach. School nurses tend to do 2 types of education besides curriculum, and that's like having specialty speakers in and special programs. It kind of grabs their attention in a different way. And then also the teachable moment, as most of you educators know. If someone's in my office and telling me something, I can do that teachable moment real quickly with them to impress upon them. And the last and probably the most effective teaching is peer-to-peer. Students listen to their friends. And so developing programs where we have students understand the dangers, the facts, and then be able to provide that to students, again, whether it's an assembly or actually having special groups during lunch, during other free times for students is, I think, really the key to education and prevention for our students.
And I want to ask Mr. Hodge also a question, which is, we're now looking at like your health department working with the county public school, which is so critical. So if you can explain a little bit more about the importance of this partnership around this drug epidemic and why that's so important to have those partnerships in place and in order to save lives.
Right. So the way that our system is set up in Montgomery County, the health department supplies all of the school nurses and the health room techs that are in each of the schools. That partnership is critical, making sure that not just for this particular issue, but for all the health issues for the students, working with them for IEPs and 504s and things like that. But for this, we don't work alone. We have to work with the administrators in the school, the teachers, security at the secondary schools, building services, anybody. It's important that everybody understand what the issue is and how to save a life. So we've been able to expand the outreach for our the Naloxone. It's in every school. It's in a variety of places throughout the school. It's not just in the health room. So if somebody sees something happening, they are trained to grab it and go and administer it. And so having that partnership, having the access to the Maryland Department of Health and the Maryland State Department of Education, and as they work together with school health issues, has made a big difference. In fact, we spent a lot of time in conversations with those two state departments and making sure that the policies that Montgomery County Public Schools and our health department in Montgomery County put into place make sense and are following the rules, but also ends up being something that they can take and expand throughout the state.
Interesting. I love what I'm hearing, and I really appreciate not only you being on this call, but the information you're bringing back, because you're speaking. We could talk about it here in DC, but you're showing what needs to happen. I say at the ground level, where the work actually happens, and each of you are providing a really rich experience. Gustavo, I want to thank you. The Fake and Fatal campaign. I love how you just put it out there. It's available. What's the website? Can you tell us the website?
Yeah, it's www.beaverton.k12.or.us. That's our website, and you're able to find everything you need there. And again, please reach out to us. We want to help.
Yeah, it might be easier to just Google Gustavo Balderas and then track it down. But I love the fact that you offered it like that, because I think we need to do more of that across the country. Don't reinvent the wheel. You have it. People can modify it to their own district. So thank you. But Gustavo, what message would you say to superintendents or boards who might feel like, look, there's so much going on in our school, I can't devote time now in curriculum, or that's not a school issue that's coming in from, that mentality that sometimes is pervasive in some of our communities. How do you respond to that, or how have you dealt with that mentality?
Yeah, this is a community issue. This is our issue. Anything that impacts our community is a school issue, and everything that impacts a school is a community issue. So how do you really educate people to understand what is happening in our schools? And I think sometimes we just, it starts with education. And I really love what I've heard today about the peer-to-peer, but also it's having community meetings, making sure our parents are aware. We recently had another fentanyl awareness listening session with our community that was very well attended. And we asked parents to bring their kids. We had law enforcement there to really talk about the issues that are really impacting us. Because again, parents don't know what they don't know. So we need to make sure that we open up our doors to educate our families about the dangers of what's out there.
So it's a process that you bring people in, and it's a shared interest in that. Thank you for that. Kate, you talked a lot about plans. You mentioned peer-to-peer, and I appreciate that, because educators know students listen to students more, right? So if you could get the influential students, the student leaders, or the athletes, or the performers to do a campaign, why not give it back to the students? But Kate, if you could say 3 things that the ideal plan has, what 3 things would an ideal plan have? And I want you to speak to those who are listening now, who are saying, oh, we have kind of a good plan. What does a great plan look like? 3 things.
Wow, I have to limit it to 3. I don't know if I can do that, but I'll do my best. So the first thing is to look at prevention and education. First plan, again, with all of those things we've talked about with education. It needs to be specific to the school and the school district. However, we need a plan that is user-friendly, that does not require a lot of work from the district. We are asking our schools to do more with less over and over. We need consistency, something that schools can take and just push out, because schools, when you asked about, well, what if you get pushback? I think that's the pushback. We don't have time. We have all these other things we're supposed to be doing. So consistent and supported materials specific to schools, but that can be easily adapted. And then the plan is part of the emergency response plan. We have emergency response plans for many other things. This just needs to be a part of it. It shouldn't be stigmatized. It doesn't need to make schools look bad. I know schools worry that they're going to look bad if they have Naloxone. Right. It's just part of what we do to make sure that children are healthy, safe, and ready to learn.
Okay, I love what you said. You said make it a part of your safety plan. You don't have to do something totally separate. Every school has a safety plan. Make it part of that. That's right. Really, that speaks to the folks that are out there that are wondering, oh, do I have to start from scratch? No, you have a safety plan. And then Mark, I'm going to turn to you, and this will be my last question, because I know Dr. Gupta has other questions. And this conversation is going so well, we could be here another couple hours, but I know we only have a handful of minutes left. So Mark, Kate talked about the ideal plan. Could you tell us, for that person that's on the call, whether it's a parent, a teacher, a principal, a public health official, a mayor that really wants to do this, what's the first step to making this possible?
So the first step certainly is buy-in. So we have to get buy-in across the board from all of the people you just mentioned, from the students to the parents to the school administrators. It's very important that everyone agrees with what's happening. I've not come across anyone who's been concerned about providing naloxone in schools or try to stop us from saving a life. And in fact, a lot of times we may hear some concerns from parents or principals or others who say, well, if you put naloxone in schools, kids are going to do drugs. That's just not the case. Putting naloxone in schools saves children who are using or misusing those drugs. So that's the first part of the plan, is just getting that buy-in, and then making sure that everyone understands what that plan is. So once you have that buy-in, once you create the plan, that you educate everyone on how to use that. And we have a big giant yellow card. It's our emergency plan. It's exactly what Dr. King said. It's the same safety plan we've always had. We just added these additional steps for drug abuse in the schools. And so that's where we are. Just making sure that everyone understands what that plan is.
It's powerful. Thank you, Mark.
Sure.
Wonderful. It's a great conversation, and one of the things that I think you just mentioned, Mark, is too often we see that schools are reluctant to have naloxone or to have training or even education in prevention, because either folks are too busy doing other important things, or it's stigmatizing. It's a question of exactly what you mentioned, that this may be enabling, and data has not panned out. And in fact, what happens is then you get an overdose and a death, unfortunately, sometimes, and then you stock up. So we don't have to be reactionary. We could be proactive when it comes to saving lives. So I want to ask each of you, because this has been a great conversation. We have so many people on the line, leaders who are probably looking to, what messages would each of you like school officials as well as policymakers across the nation to hear? That's part one. And part two, in addition to, because this couldn't be said enough times, what are those things that we could do right now? We heard about safety plan. We've heard about peer-to-peer communications involving parents, families. and having buy-in amongst other things. So maybe the first piece of the question, and I'll start with you, Mark, is what message would you like to see school officials to send to from your end, as well as policymakers across the country? And then, if you haven't already, or maybe you could repeat that, what are those steps that folks can take here that can actually end up in saving lives and preventing this from happening in the first place? So, go ahead, Mark.
Sure. Though, from my perspective, this is an all-in approach. This isn't just about school nurses. This isn't just about school administrators. This isn't just about parents. This is about everyone. This particular epidemic for fentanyl use is an all-in approach, and we have to look outside the box. We have to consider all possibilities for addressing this issue in the school and in the community. Part of what Montgomery County has done, we quickly followed in the steps of Los Angeles Independent School District and making sure that our students are allowed to carry Narcan in schools. So it's not a dangerous drug. It's a life-saving drug. If someone happens to give it to someone who doesn't need it, nothing's going to happen. And so part of that is an education piece as well. But we now have an official policy that started May 1st in Montgomery County that allows students to self-carry Narcan to help their friends, to help themselves. It's not a mandatory thing. We don't ask all students to do that, but if they are interested in doing so, they will not get in trouble for carrying it. They might get in trouble for carrying ibuprofen or some other drug into school, but not Narcan or Naloxone. And then getting access to that. So it's going to be over the counter very soon. I know the FDA has already approved it for that, but once it is in the supermarkets, once it's in the pharmacies, it's making sure that people have access to it, whether it's in schools or at home in the community. Montgomery County is looking at putting vending machines in our libraries to make it free. So we don't know what the cost is going to be in those pharmacies, but for those who can't afford to buy it directly from there, may be able to access it through our library system, just like what they did for COVID tests. And so we learned a lot from that in our ability to get some of these things out in the community. But it's that we have to look at all possibilities. The availability of Narcan everywhere is going to save a lot of lives. And so that's what we're looking at now is what can we do to address this? And no idea is a bad idea.
Thank you, Mark. And Kate?
I'd like to say that now is the time. Now is the time, and you can do it. I think those two messages are the most important. Collectively, together, as Mark said, we can do this together. I would like to see a maybe national repository where everyone has access to the tools, the funding, the resources for schools to do this. I think it is key to make this easy for schools to do. Of course, I would be remiss in my profession in saying that I think access to a school nurse all day, every day for every child is key to this program as well. And while I say that tongue in cheek, that school nurse is the leader in this situation. It is the leader in health. She is a leader, or he, in healthcare, and the school nurse is a person that can pull this collaboration together.
Thank you, Kate. Gustavo.
Parents are scared. Fentanyl is an absolute game changer, and our notion of a typical drug user is dated. Many of our kids are self-medicating and with what they think are prescription drugs to deal with mental health issues that we've experienced that they've experienced in the pandemic, even before the pandemic. But of course, they're not really getting those medications. They're getting cheap and deadly fentanyl. So we really need to recognize that. We also need to take a non-punitive approach to addiction. We've shifted our thinking about this in Beaverton. We no longer have kids need to have a disciplinary occurrence to get help. Our substance abuse specialists take referrals from staff or other students, or students can even refer themselves for help without any fear of repercussions. And we're seeing kids needing that help at a younger age, as been stated earlier, not just middle level, but even elementary level. And we need to have a K-12, a PK through 12 understanding of how to address this issue and really work with our community partners, because it's going to take an entire community to take care of this situation and be able to inform parents about the pitfalls with these type of drugs.
Thank you so much. This has been
You.
really a wonderful panel and a great discussion about what's going on at the local level. We really appreciate it. Before we go to the question and answer, I know that Director Gupta and Secretary Cardona have to leave us. So I'm wondering if you'd each like to offer some closing remarks for our audience. Dr. Gupta?
Well, thank you. I want to thank Secretary Cardona. I want to thank Kate, Mark, Gustavo. Also want to thank you, Elizabeth, Beth, as well as Helen and Elise and Shelley here. And more importantly, thank you for everyone joining. It's been a fascinating conversation. The Secretary and I, on behalf of the President, would say that this is a top priority for the administration, to provide those resources to communities to ensure that we leave no life unsaved and then allow them the help that they need beyond naloxone. But it starts with prevention. It starts with making sure that this becomes, as Kate has said, part of our prevention education plan, part also of our safety or emergency plan. So I think we've learned today some really important things from leaders in communities doing the work of how we can actually be more impactful in the 21st century right here to save more lives. And the resources that are available now are historic and unprecedented, and we aim to continue to do that. We look forward to engaging with you. And with that, I'll turn it over to Secretary Cardona.
Thank you very much, Dr. Gupta, and thank you, Elizabeth, for moderating the conversation, and to our teams who are putting this together along with the support of the White House. Gustavo, Kate, and Mark, thank you. You know, your experience, but your passion for this is really, I think, what we're also taking away is what's needed. We need people that understand that our kids are in crisis and they need us now. And it's a different type of leadership. It's a different type of collaboration, but they need us and we need to deliver. I agree, Dr. Gupta and I want to make sure that we're working together and bringing whole of government here, because that's, if we talk about intentional collaboration at the district, the state level, we are also walking that walk here, and we want to work together to support you. You know, 3 years ago, we faced the unimaginable, and we did things in ways that we'd never done in the past, right? And we collaborated because we had to protect lives, and we did that. It was tough, it was scary, but we did it. You know, we see community violence spread and school shootings, and sadly, our schools are not immune to the violence in our community, and we've seen more school shootings this year than in many previous years. But we've come together to provide additional support, mental health support, and even provide resources to schools to improve their safety plans. We came together to protect lives again. It's not a red or blue. It's not an urban or rural. It's an American issue. We came together to protect children's lives. We're called to do that again here. We have strategies that all of you are leading, and it's our responsibility to bring those strategies to bear across the country to make sure that we're protecting lives once again. I want to thank you three panelists for your expertise, for your passion on this, for your leadership on this. We have an opportunity to lead in a way where our students are asking, they need us. And I appreciate the comments that were made. Yes, we need more nurses. Yes, Mark, it has to be a strategic plan. And Gustavo, we need the courage to say, this is now part of our pre-K-12 DNA in our district, because that's what our kids need. With leaders like you, I feel confident we're going to get it done. We're going to continue to support the work you're doing and continue to lift up best practices across our country. I want to thank you for the opportunity to be here with you all, and I wish you the very best as you move forward.
Thank you both. We really appreciate your time today. And we'll move now to the next portion of our town hall, which will feature the three panelists that you have been listening to so far today. And we'll also bring into the room a few other panelists. So we will have Helen Hernandez, the Assistant Director for Drug-Free Community Support Program, Elise Robertson, the Program Specialist for the U.S. Department of Education, and Shelley Bailey Shaw, the Communications Director for the Beaverton School District in Oregon. I am not sure if my Zoom seems to have gone out. Okay, there we go. The computer has a mind of its own today. So now we have all of you to join us, and we fielded some questions through the registration process. So let's start with a question I think that would be best for Shelley and Helen, and it comes to us from someone in the audience. What are the best prevention strategies for middle school students, for high school students, and early elementary school students? So this is very broad, but something I think between the two of you, you're probably well suited to address.
Shelley, you want to go ahead and get started?
Sure. No matter what the level is, I think we have to have a multi-pronged approach. And here in Beaverton, we started with a community outreach campaign, and it was multi-tiered. There was a video storytelling element, there was a social media blitz element, and a community conversation event. And particularly with middle school, I don't think or high school, I don't think we should be afraid to use social media as a tool. And what we did here is we picked a week in which we pushed out educational content, fact-based content to our students that they saw on their feed, their parents saw it on their feed, and then we allowed them to interact and ask questions. So I'd say be using all the tools in your toolbox.
And I'll just add, I think the best prevention strategy for middle school and high school students is the one that's tailored to your school's community's unique needs. I think it's important that we think through, and then it's critical that we first understand what drives youth drug use, that we identify the current and emerging drug trends in our communities, in our school districts, and that we match programs and policies with local conditions so that we can be effective. You know, we have to address, and I'm sure you've all heard this before, but there's not a one-size-fits-all approach. The same is true for prevention interventions. The interventions should be addressing the root causes in order for us to be effective. And it's not just at preventing addiction. We know that many of the root causes for addiction and the development of a substance use disorder can impact a whole range of other issues. And so, you know, I always like to, during these question and answer sessions, to offer resources. And so there is a resource that I wanted to share called Blueprints for Healthy Youth Development. And this is a registry of evidence-based prevention interventions. And on this registry, again, you can select the age, the gender, the race, the ethnicity, the program setting. Is it in school, after school? Use that registry as an opportunity to find interventions that are, again, based on evidence that they're going to be unique to your unique needs.
Thank you both. And so one question that has come up several times at Department of Education is, we've talked about a lot of great programming and resources. What types of funding resources might there be available through the U.S. Department of Education to help with starting up some of these programs that our speakers were so kind of speak up?
Yes, certainly. No, thank you for the question. And I think everybody is always curious about funding. But yes, the Department of Education, we do offer programs that can support student safety and health and improve school climate, which can include drug prevention programs and activities. I'll just share kind of two programs. One being the Title IV Part A Student Support and Academic Enrichment Program. This is one of our grant programs that focuses on increasing the capacity of state educational agencies, local educational agencies, schools, and communities. And this program in particular has three broad categories, which are to provide all students with access to well-rounded education, improve conditions for learning, and improve the use of technology. But it's really that second category where funds may be used to support the health, safety, and also can include drug prevention programs, within schools and school districts. And then the second program that I'd like to mention is from the Bipartisan Safer Communities Act. So that act provided $1 billion for state educational agencies to competitively award subgrants to high needs LEAs or local educational agencies to support student safety and health, which we know can include activities to support drug-free learning environments. And states have been working on setting up their Stronger Connections programs. And like I said, this is a new program. So I would certainly, for interest, reach out to your state educational agencies to learn more about this program and this new, this new set of funds that are specifically targeted for student safety and health.
Thank you so much. And for our three earliest panelists, you all spoke about having naloxone available in your schools. And also we touched a little bit about stigma previously with Secretary Cardona and Director Gupta. I'm wondering if you could talk about how you brought these efforts into your school and sort of push back against the resistance that maybe you saw. We'll start with Dr. King.
I think what is so important, especially in a school, is that buy-in is to ask staff and employees what their fear is, what is going on, and address those with evidence-based research and results. Once you get that buy-in, that we're not going to have drug addicts camping out in our parking lot just to get naloxone because they know the school has it, or that students will do more drugs because we have that naloxone. And also there's the fear of like touching fentanyl and getting all of that, and assuaging those fears with a very solid plan is critical to getting this started. That way you have the buy-in of the school staff and the school administrators, and you can move forward from there. That's the first step.
Thank you. Dr. Balderas?
And again, following Kate, we've had very little resistance in terms of our efforts here. And that's because I think, as I said earlier, we've done a great job of front loading the campaign with our community to the why. And you can't argue about the why. But once people understand that, I think you're going to get the strongest supporters from your community and from our kids. So I think it's just making sure that you have a solid pre-K through 12 intervention system and explain why you're doing it. And again, we have not seen any resistance to our efforts here in Beaverton.
Great, thank you. Mr. Hodge?
Sure. So since about November of this school year, we've been, my partners at the Montgomery County Public Schools have been hosting town halls that have invited the whole school community. We've been doing it all over the county. That includes members of the school system, from our Department of Health, from police, from EMS, or 911 staff, from our Montgomery Goes Purple nonprofit in the community, as many people as we can, subject matter experts as we can, to be there to provide information for parents. Each of the town halls has had about 800 parents and students attending at each of the schools in person, and then another several hundred online at the same event. And we've been able to offer information, answer questions. We have a whole Q&A session. We've been able to divide up into different groups, one for students, one for parents who speak English, and one for parents who speak Spanish. And so they can get their questions answered that way. We've been offering Narcan training to anybody who wants it at the end of those town halls. And so because of that, we've been able to do a lot of outreach into the community. We've been working with other nonprofits now to actually get more information out into some specific communities in our county, and that has made a big difference. And so when MCPS rolled out the student policy for Narcan, we got very little pushback because we had done all that education up front. And I think the members of our community really see the importance of that.
Thank you. And yes, I think these are all great strategies and so important to bring people in with education and presenting them with the evidence. That's critically important. Well, I want to tell our audience that this webinar will be has been recorded, and so it will be archived, and we will be able to send you the link once it is up and posted, so that you will have a resource to go back to for these important discussions and resources that were mentioned. I would also mention that all of the websites for the school districts and for the Department of Education and Office of National Drug Control Policy will have additional resources for everyone if you Google them. So I thank you all for your attendance today. It's been a really great conversation, and we're looking forward to having more of these conversations in the future. Have a safe summer. Thank you.